UK and how it's moved forward in putting in place measures to stop the spread?
Well, I think there are two things to be said, and this is the first thing is that a significant challenge for the government on this is that the progression of the virus and the infections in the UK is not evenly spread. So the variations, for example, between the southeast of the UK and London are quite marked. And so there are different social dynamics there, different densities of population, and different behavioural styles, different sort of social interaction, which makes a government policy on this very, very tricky because it has to vary with the different areas and the progression of the disease. But what has happened is that initially the government wanted to just calm people down, but also gradually generate a feeling that there was a risk, there was a threat, because what they wanted to do was save the sort of the most stringent measures for the time at which they felt that the virus was really in a position to explode across the population, and that would put big pressure on the healthcare services. And it's been the same problem across, I think, every country that's been deeply affected by this. So what has happened now recently is that the Prime Minister, the day before yesterday, issued an edict saying that everybody was to stay at home apart from a very small list of necessary tasks, buying necessary household items, food, this sort of thing, medicines, one exercise per day, this sort of thing. So there is an increasing ramping up of the government's approach on this to try and prevent the disease really exploding and overwhelming our healthcare services, whilst the government at the same time builds up the healthcare system. So the army has been brought in to assist. There's a 4,000-bed hospital being created in London, jointly by the Army and the National Health Service, for example. And they've just called for 250,000 volunteers to assist the National Health Service.